More changes are coming to vaccine guidelines in the U.S. after a newly reformed CDC advisory panel spent the weekend shaking up existing policies. The members who were appointed by Health Secretary Robert F. Kennedy Jr. got into heated debates clashing over science and how to rethink immunization practices on a range of diseases. Our senior correspondent Brenda Flanagan joins us now to break down the key changes and what it means for vaccine recommendations moving forward. Brenda.
Hey, Brianna. So this newly appointed CDC committee, with some members that are openly suspicious of U.S. vaccine policy, spent 2 pretty chaotic days making changes and defending themselves against sharp critics, including each other, as they tried to redefine vaccination guidelines for the U.S. President Trump's health secretary, Robert F. Kennedy Jr., who's made his skepticism of vaccines known, handpicked these 12 advisors after firing all of the old members of the ACIP. That stands for Advisory Committee on Immunization Practices, and it makes recommendations on vaccine policy for the CDC. Kennedy challenged his new panel to re-examine public health strategies for vaccinations against several diseases, including measles, chickenpox, and COVID-19. But his new panel got off to a rocky start over 2 days of often contentious debate. 5 members are brand new. Some questioned what their votes actually meant. The American Academy of Pediatrics boycotted the meeting, and members clashed with each other and with angry liaison groups. Critics charged ACIP members with cherry-picking unqualified research and skewing decisions based on personal anecdotes. The atmosphere crackled with partisan politics.
You're not looking at all of the aspects of how we evaluate vaccine implementation. You're looking at very small data points and misrepresenting how it works in the real world and how we take care of our patients. So no, this was not a thoroughly vetted discussion.
We desperately need to rebuild trust between the American people and public health, medical, and scientific communities. Secretary Kennedy has stated that he wants to do this, but his actions indicate otherwise. The Secretary said he would not interfere with the work of this committee, yet he fired all 17 members without cause and appointed the new members here today, most of whom have anti-vaccine track records. Secretary Kennedy announced new COVID-19 vaccine guidance on social media. In this moment, I cannot sit silently as Secretary Kennedy undermines science, public health, and vaccine access in this country. I urge the public, Congress, and this administration to take proper action and restore the competent science-based leadership at HHS and CDC. For the health and safety of American families, Secretary Kennedy must go.
In an attempt to appease a small segment of the population and in an attempt to uplift the beliefs of one particular administrator in the government, we're putting the health of children and the health of families at risk. And, you know, whether we're talking about COVID-19 vaccination or we're talking about the MMR vaccine or hepatitis B, all of this is bound to have an effect on the health of the well-being of the population.
Now, Perry Halkitis heads Rutgers School of Public Health. He said the panel presented studies that CDC scientists had dismissed as flawed. But ACIP circled the wagons. Several members took extreme offense at attacks on their expertise, insisting they were bringing a more open mind to an ongoing debate that's eroded public trust in vaccines.
We welcome scientific critique of any of our votes, as there are gray areas due to incomplete scientific knowledge. But false accusations that we and other respectable vaccine scientists are unscientific and dangerous anti-vaxxers, that just adds legitimacy to anti-vax positions, damaging both public health and the confidence in vaccines. Such false accusations are only logical if their purpose is political.
The position that many in the United States encounter with this birth is that a medical professional acts in a unilateral fashion to perform a medical procedure, an injection, without substantial informed consent. And as we know, exacerbated by the events around COVID, there has been a significant decrease in public support for vaccination and a significant increase in concerns about public health and the ability of the population to rely on public health.
So what did this panel change? Well, they advised limiting a particular quad combination shot for measles, mumps, rubella, and chickenpox to kids over 4 years of age. But that's already been suggested by the CDC. As for COVID, ACIP members voted to recommend folks 65 and over who get a COVID shot should talk it over first with a clinician. The panel also recommended everyone 6 months to 64 years of age should discuss risks versus benefits of the COVID shot with their medical professional. And they almost voted to require a prescription for COVID vaccinations. It was a 6-6 tie, but the chair voted no. Now in New Jersey, the Department of Health has already established prescriptions are not required for COVID shots. Most people just get them at a local pharmacy.
So they actually voted down that requiring a prescription, which I thought was very important, because that will clearly, that would make access much worse. And one of the committee members made the point. He said, you know, I can't call up and get an appointment with my physician for next week. It's an unreasonable ask, and it would mostly harm the people who are at highest risk.
We put out our own state level recommendations, which, align with many other states in the collaborative, that if you're 6 months or older, you should consider getting an updated 2025, 2026 COVID shot. And we put in place in New Jersey an executive directive and a standing order to really help consumers get access to those vaccines.
Now, acting New Jersey Health Commissioner Jeff Brown says New Jersey is working in collaboration with several Northeast states, plus New York City, to adopt their own vaccine policies, but they're keeping an eye on ACIP recommendations. Brianna?
All right, Brenda, great reporting as always. Thank you.
Thank you.
Support for the medical report is provided by Horizon Blue Cross Blue Shield of New Jersey, an independent licensee of the Blue Cross Blue Shield Association.